Did you know that 1 in 8 men will develop prostate cancer at some point in their lives? And the worst part, this silent disease shows no clear signs until it's too late. What can you do to protect yourself? Today, I'll reveal 8 silent warning signs that many ignore. And the last one is the most common. If you want to avoid this threat and increase your chances of recovery to 90%, watch until the end. Your health could depend on it. Prostate cancer is one of the biggest threats to men's health. And the scariest part, it creeps in silently, showing almost no symptoms until it's too late. Did you know that 1 in 8 men will develop it at some point in their lives? And that prostate cancer is the second deadliest cancer among men. But here's the good news. If caught early, the survival rate is over 90%. That's why it's crucial to recognize the first warning signs. Many men ignore the symptoms because they seem minor, but that's exactly the mistake that can cost lives. Today, we'll go over 8 silent warning signs you should never overlook. And the last one on the list, it's the most common symptom and the one most men ignore. So stick around until the end to find out if you could be at risk. Before we dive in, if you care about your health, hit that like button and comment, "Health is my priority." That way, we can spread this important message to more people. Ready? Let's get started. Have you noticed yourself running to the bathroom more often than before, especially at night? This could be a silent warning sign of prostate cancer. A healthy man typically urinates about 6 to 8 times a day, and no more than once at night. But if you're waking up multiple times to pee, your prostate might be enlarged, and that's something you shouldn't ignore. This condition is called nocturia, and it happens when the prostate starts pressing against the urethra. As a result, your bladder never feels completely empty, making you feel the urge to pee again and again. Many men blame it on aging or drinking too much water before bed. But if it keeps happening, it's time to get it checked out. Another issue that often comes with frequent urination is a weak or interrupted urine stream. You might feel like you need to pee, but it takes forever for the flow to start. Or maybe the stream stops and starts unexpectedly. These changes aren't just a normal part of aging. They could be a sign of an irritated or blocked prostate. So ask yourself, have you noticed any changes in your urination habits lately? Don't brush it off. If you're waking up at night or feeling like your bladder never fully empties, talk to a doctor. Catching it early could save your life. Drop a comment below if you have questions. I'd love to help. Have you ever felt like you had to rush to the bathroom immediately, almost as if you couldn't hold it in? This is called urinary urgency, and it could be an early warning sign of prostate cancer. Your prostate sits right under your bladder, and when it enlarges, it can mess with your ability to hold in urine, making you feel like you need to go ASAP. The tricky part, most men mistake this for a bladder infection or just getting older. But if you keep feeling an intense need to urinate, even when you haven't been drinking much, your prostate might be telling you something. The sooner you get it checked out, the better. Another common issue is the constant feeling of a full bladder. Have you ever peed, only to feel like you still need to go right after? That's because an enlarged prostate can partially block your urethra, making it harder to fully empty your bladder. Not only is this uncomfortable, but it can also lead to infections if urine keeps getting trapped. So, pay attention to your body. Do you often feel a sudden, strong urge to pee? Does your bladder never feel fully empty? These aren't just small annoyances. They could be warning signs of something serious. Drop a comment below if you've noticed this or have any questions. Have you ever felt like you needed to use the bathroom, but nothing really happened? Or maybe you felt like you didn't fully empty your bowels, even after going. This might not seem like a big deal, but it could be a sign of an enlarged prostate. or even prostate cancer. The prostate sits right in front of the rectum, and when it enlarges, it can press against your intestines. This can make you feel like you have to go, even when you don't. A lot of men mistake this for digestive issues, or even hemorrhoids. But if this feeling keeps happening, it's time to see a doctor. Another common problem is that this pressure can make it harder to pass stool. Some men notice that they need to strain more, or that they're getting constipated more often. That's because an enlarged prostate can interfere with the normal movement of the bowels. If you notice changes in your digestion, don't brush them off. Remember, your body is trying to tell you something. Are you listening? Have you been feeling pressure in your rectum or unexplained bowel issues? If so, don't ignore it. Drop a comment if you have any questions. Do you have back pain that just won't go away? A lot of men assume lower back pain comes from hard work, bad posture, or just getting older. But what many don't realize is that prostate cancer can spread to the bones, especially the spine. The prostate has a strong connection to the skeletal system. When cancer cells spread, they often attack the bones, causing deep, aching pain that doesn't go away, even with rest or painkillers. If your back pain gets worse at night, or you can't find a comfortable position while lying down, that's a red flag. Many men ignore this pain for months, thinking it's just muscle tension. But if your back pain comes out of nowhere and won't go away, don't just chalk it up to aging. Seeing a doctor can help determine whether your prostate is the real cause and whether further tests are needed. So, be honest with yourself. Have you had ongoing lower back pain with no clear reason? Does it get worse at night or after sitting for a long time? These could be warning signs. Drop a comment below if this sounds familiar, or if you have any questions. Have you ever noticed a reddish or brownish tint in your urine? Or maybe blood in your semen? It can be alarming, and it should be. Blood in urine, hematuria, or semen, hemospermia, can be a warning sign of serious issues, including prostate cancer. While there are some harmless causes, like infections or tiny blood vessel injuries, blood where it shouldn't be is always a reason to see a doctor immediately. This is especially true if there's no pain or other symptoms, because prostate cancer can grow silently for years before showing signs. Some men ignore blood in their urine or semen because it only happens once and then disappears. But that's a huge mistake. Even if it's occasional, it could mean something is wrong with your prostate. The sooner you get it checked, the better your chances of catching and treating the problem early. So, pay attention to changes. Have you ever noticed blood in your urine or semen? Even if it only happened once, talk to a doctor. Drop a comment below if you have questions or concerns. Do you feel pain or a burning sensation when you pee? Most men assume it's just a bladder infection, or maybe irritation from spicy food or alcohol. But what if this symptom doesn't go away? It could be a warning sign of prostate cancer. The prostate surrounds the urethra, and when it becomes enlarged or inflamed, it can affect urine flow, causing pain or a burning sensation. Many men ignore this issue, hoping it will pass on its own. But that's a dangerous mistake. Of course, conditions like prostatitis, prostate inflammation, or urinary tract infections can also cause this symptom. But if you experience persistent burning or pain when urinating, especially alongside other symptoms like frequent urges to pee or a weak stream, it's time to see a doctor. So, ask yourself, have you noticed any burning or discomfort when urinating? Are you brushing it off, hoping it'll go away? Your body is sending you signals. Listen to them. Drop a comment below if you've experienced this or have any questions. Have you ever felt pain or discomfort during or after orgasm? Many men don't talk about it because they feel embarrassed. But painful ejaculation is not normal, and it could be a sign of prostate cancer. The prostate plays a key role in semen production. If it's enlarged or inflamed, it can cause pressure or pain during ejaculation. Some men feel a slight pulling sensation, while others describe a burning or stabbing pain. Either way, this isn't something to ignore. Of course, conditions like prostatitis, prostate inflammation, or infections can also cause this symptom. But if you experience pain when ejaculating regularly, especially alongside other warning signs, like frequent urination or blood in semen, you need to see a doctor ASAP. Think about it. Have you noticed pain during orgasm lately? Have you brushed it off, hoping it's nothing? Your body is sending you a message. Listen to it. Drop a comment below if you have questions or want to discuss this topic. Have you lost weight recently without changing your diet or lifestyle? Or do you feel constantly exhausted, even after a full night's sleep? These symptoms often go unnoticed, but they could be signs of advanced prostate cancer. When the body is fighting cancer, it burns through energy at an alarming rate. Cancer cells alter metabolism and steal vital nutrients, leading to rapid weight loss and chronic fatigue. Many men blame stress or aging, without realizing their body is trying to send them a warning. Another major red flag is fatigue that just won't go away. We all have long days, but if you've been feeling drained for weeks, lacking motivation, or struggling with simple daily tasks, something bigger might be going on. Cancer can weaken the immune system and deplete the body long before other symptoms appear. So, ask yourself, have you suddenly lost weight or been feeling exhausted for no clear reason? Don't ignore these signs. Drop a comment below. Have you or someone you know experienced this? Let's talk about it. Today, we covered 8 warning signs that could point to prostate cancer. Some of them, like frequent urination or back pain, seem easy to ignore. But that's exactly what makes this disease so dangerous. The earlier you catch it, the better your chances of survival. Prostate cancer can grow silently, without obvious symptoms. But now, you have the knowledge to listen to your body and take action. Prevention is key. If you're over 50 or at higher risk, talk to your doctor about regular screenings. If this video helped you, drop a "Health is my priority" in the comments. Share this with your friends, brothers, or fathers. It could save a life. And don't forget to like this video and subscribe to the channel so you never miss important health updates. Stay safe, take care of yourself, and I'll see you in the next video.